Hello, it's Dr. Shelley, and I am here to teach on electrolytes and fluid balance. Now, we're going to start with electrolytes, and you should have a handout because it has everything in it. Even though it says acid, base, and balance, it has your electrolytes and some fluids in it. And I want you to start by turning to the page that actually says potassium, because that's where we're going to get started. Now, let me just say a few things. I know that my students are losing their mind because of coronavirus. And just in case you want to read the hype on social media, don't. First of all, this is very serious. Second of all, you're a scientist and you're a nurse. So you already know that science dictates what's going to happen. And this is a virus. You can't get rid of it with a hot tub or a sauna or any over-the-counter or online product. So just remember, please, that anybody calling this like a big hoax or like a joke is an asshole. And you, my love, are a scientist. So you must take this seriously because we have people dying. All right, got that off my chest. Now we can continue. Now, so here we go. When you think of electrolytes in general, that means every one of these, you need to remember two things that'll really get you through. Number one, any electrolyte imbalance typically causes a seizure. So that's always the right answer anyway. But all of them, any kind of imbalance, will cause also muscle weakness, okay? Now, so that being said, let's start with the big kahuna. The biggest problem on this board is always going to be potassium. You know yourself that if someone has an imbalance in potassium, you're going to be looking for an EKG to throw on their little body. You also should know at this point, in general, that potassium will affect the heart, the GI system, and the renals. The kidneys are going to be affected, your tummy, digestion and everything else will be affected, and of course that lovely little heart, which is why you threw that EKG on that patient. Now, we have to remember it like this. Potassium controls muscles. When there is none, there's no muscle movement. When there's too much muscle movement. So that kind of helps a little bit, okay? And on the other end of the stake, potassium kills kidneys. All right, so that being said, we need to look at the level. If you look at this page, it clearly gives you an outrageous high, and it clearly gives you an outrageous low. So you know that those are ridiculous. And a nice little happy medium is 4.0. Now, it's true that 3.5 to 5.3, and I always take the numbers and just flip them. 3.5, flip, 5.3. It's really true that 3.5 and 5.3 is normal. So 3.5 to 5.3 is a normal potassium level. But if you work in any unit in America, especially the ones in Cleveland, like at university hospitals, my favorite, or Cleveland Clinic, or Metro, Metro's my second favorite. So if you work at any of these hospitals in Cleveland or abroad, you know that you're going to have to know that a 4.0 is considered necessary for almost every cardiac patient that you would ever come into contact with, okay? So don't be shocked if they treat a 3.5. Now, that being said, as we continue, we have some relationships that you have to know. Number one, potassium is divorced from sodium. So if potassium is high, sodium is low. If sodium is high, potassium is low. They are divorced. You have to know they're divorced, okay? They're not going to the christening together. They're not going to the graduation together. Wherever one is, the other one's just the opposite. So they are divorced, okay? Now, when you look at my board, my magical board, look at what I did. I gave you three big deals. DKA, diabetic ketoacidosis, AKI, acute kidney injury, CKD, chronic kidney disease. All three of these have a very, very high K, and that is going to be important for you later. Now, let's see what else we can get our little selves into. I'll come back in just a second because we're going to do another electrolyte.